I've sat across from patients who told me, "Doctor, if only I had come earlier." Not because they didn't have symptoms, but because they believed the wrong things about cancer. Some of the things you believe about cancer are not just wrong, but dangerous. Dangerous enough to delay diagnosis, dangerous enough to stop treatment, and dangerous enough to cost lives. Today, I want to talk about the cancer myths we still believe and why believing them could be deadly. Stay with me. This information could save a life, maybe yours, maybe someone you love. Myth 1. Cancer is a death sentence. This is the most dangerous myth of all, because the fear alone would have crippled your will to fight, and this can lead to delay on multiple levels. Many people hear the word cancer and think it means the end. I understand why. Cancer has taken loved ones from many families. The pain is real. But medically speaking, cancer is not automatically a death sentence. Many cancers today are curable, especially when detected early. Breast cancer, cervical cancer, prostate cancer, colon cancer, thyroid cancer, childhood cancers. Even advanced cancers can often be controlled for years with modern treatment. Medical truth. Survival depends on type, stage, biology, and treatment. Early-stage cancers can often have very high cure rates. Why this myth is dangerous? The real danger is not cancer alone. The real danger is believing there is no hope and staying away from care. Myth 2. Cancer is caused by spiritual attacks or witchcraft. This is a sensitive topic, and medically speaking. Cancer is not a punishment. It is not witchcraft. It is not a curse. It is a biological disease. Cancer is a disease of cells that have lost normal control because of genetic damage. Cancer is caused by genetic mutations, infections like HPV and hepatitis, smoking and alcohol, obesity and poor diet, environmental exposures. Faith is powerful, and by all means pray, but these should not replace diagnosis and treatment. Why this myth is dangerous? Patients waste precious months seeking spiritual solutions while the cancer quietly advances. Myth 3. If it doesn't hurt, it's not cancer. This myth kills quietly. One of the most heartbreaking statements is, "Doctor, it didn't hurt, so I ignored it." Early cancer is often painless. Breast lumps are usually painless. Cervical cancer may bleed without pain. Prostate cancer is often silent. Colon cancer may cause subtle symptoms. Pain usually appears late, when damage is already significant. Warning signs you must never ignore: a lump, abnormal bleeding, persistent cough, unexplained weight loss, non-healing sores. Don't wait for pain. Waiting for pain is like waiting for a fire to burn your house before calling for help. Myth 4. Biopsy or surgery makes cancer spread. This myth has cost many people their chance of cure. As a pathologist, biopsy is how I know what we are dealing with. Medical truth. Biopsy does not spread cancer. Surgery removes cancer. It doesn't cause it to spread. Cancer spreads because of its biology, not medical procedures. Without biopsy, we cannot confirm cancer. Without confirmation, there can be no proper treatment. Why this myth is dangerous? So when people refuse biopsy, we lose the window for a cure. Myth 5. Herbal and alternatives to medicine can cure cancer. Let's be honest, this is a painful topic. I understand why people turn to herbs or supplements: fear, cost, desperation. No herbal product or supplement has been scientifically proven to cure cancer. Many herbal mixtures damage the liver and kidneys. Some reduce the effectiveness of chemotherapy. Some patients stop hospital treatment for herbs and return months later with a disease that is no longer curable. Hope should never be built on false promises. If herbs truly cured cancer, oncologists would be out of work. Why this myth is dangerous? Patients abandon proven treatment for untested remedies and return when it's too late. Myth 6. Cancer is contagious. Cancer is not contagious. It does not spread by touch, sharing food, or caring for someone. Please don't isolate cancer patients. They need support, not stigma. Myth 7. Nothing can be done. Once cancer is diagnosed, this is simply false. There is always something that can be done. Medical options: surgery, chemotherapy, radiotherapy, hormonal therapy, targeted therapy, immunotherapy, palliative care for comfort and dignity. Even when cure is not possible, relief from pain, breathlessness, and suffering is possible. The truth that changes outcomes. Let me leave you with these truths. Early detection saves lives. Cancer is treatable, especially early. Myths delay care. Hospitals diagnose, not pastors, prophets, or herbalists. Knowledge is power. Cancer grows in silence, fear, and misinformation. It shrinks in the presence of early detection, science, and timely care. Final message. If you or someone you love has symptoms, please seek medical care early. Come early, ask questions, get answers. Cancer thrives in silence, fear, and misinformation. If this video helped you, share it. You might save a life. Subscribe for more cancer awareness and pathology education. Together, we replace fear with facts and myths with medicine.